The medical outreach program is actually an annual event that His Royal Majesty of Professor Alexander Olusegun McGregor has always put together since he ascended the throne. Being a professor of pharmacology himself, he understands that health is wealth. And if you look around us, because of the economic situation, a lot of people are unable to take care of their health because they can't afford to really do it. And so it is His Majesty's way of giving back to the society, to the community, to the kingdom, and to Nigeria at large. Today, we're targeting about 2,000 to 3,000 persons because, we have informed all of our people. And as you know, under Orile Lao Kingdom alone, we have over 167 towns and villages. And so we have let our people know that such an event will be taking place today. And we're expecting them, not just from our people, from everybody, from far and wide, far and near, anybody who feels like their health is a concern to them. We expect that they will be here today. And this special event this particular one is proudly sponsored by one of our own, the Otumba of Orile Lao. He himself is a medical doctor, American trained. His name is Otumba Dr. Adeshola Adewumi.
I've been practicing for over 20 years. I practice internal medicine and critical care in the ICU. What I realize is that the doctor to patient ratio in Nigeria is it's concerning. We have a large population, but we don't have a lot of doctors. And the only thing that we can do as far as being out of the country is to bring some of that here to help kind of alleviate the ones that are not able to see doctors. And so we've been doing this for some time now. We've done it here, we've done it in, Ijebu area, and we've gone to Osun in different places. So this is our way of giving back to our community to make sure that people stay healthy.
We are not just checking. When they come here, we ask them, okay, what are the signs, what are the symptoms? We prescribe the ones that need drugs. For the ones that don't need, maybe just lifestyle changes. We advise them on lifestyle changes that they should make.
Most of the time, we think everything is about medicine, but sometimes it's just about, education about what's going on. Sometimes people don't need medicine, they just need the advice on what to do. Sometimes when you have a headache, it doesn't mean that, something is wrong there. Maybe you just need some rest. Maybe you just need to drink some more water. So some of those things is what we look at to see how patients or people can do better with their own health. When they need medicines, we see them, we look at their chart, we talk about it, and then we prescribe it to them. I like personal interactions. The best thing to do for your patients is to see them, talk to them, interact with them, and see how they're living. When you talk to them personally and see how they live, and you can kind of diagnose what's going on with them. It's different from me talking to them on the phone versus actually in person to see and interacting with them. And by so doing, you get better connections and to see what's going on with them.
I think what we are beginning to see now is a lot of glucose control issues. It's a really common thing now. In fact, it has become a standard of practice now that when you see a patient come with, maybe they are hypertensive, they are having dizziness and all of that, tiredness, the first thing you want to do is to check their blood glucose. And somehow it's becoming, it used to be hypertension. So, but now we are having, hypertension has its own population now. But unfortunately, our glucose control, that means diabetes, is now becoming a really prevalent thing now.
It's not that people don't want to take their health seriously. We know that people want to take care of themselves. Sometimes it's financial. They know that they have to take medicines, but unfortunately they can't afford it. And so what we tend to tell them is that as much as you can, whatever you can afford, if you can afford to eat or to get some food, you should be able to at least get some medicines to help your body. Because when your body is not right, even the food will not go right.
And one thing we've seen over the years is somebody is hypertensive, they're already on drugs. They will just decide, I'm not using my drug today. And it doesn't work like that. The circulatory system already has shown a sign that you need to help me. Don't just decide to withdraw the help whenever you feel like. So it cannot be cured, but it can be managed effectively. So through their lifestyle, you are hypertensive, you are diabetic, you are still taking alcohol, you are still eating very late. So lifestyle management is really important. And of course, you can manage it well by just doing everything right.
We are appealing to our government to see if they can reduce the prices of the medicines that people need. That's the most important thing for them. Now, they want to take care of themselves. So most of the people want to see doctors. They do, but they don't have the means to see the doctors. And so that's why we have a lot of people outside, because it's free. So if they're able to see doctors, people will take care of their own health. And all of these things is manageable. But unfortunately, with the way the situation of the country is, it's hard for people to pay for anything. And so because of that, they think about eating first. They think about taking care of their family first before they even go see their doctor.
My advice has always been that health is wealth. Without your health, without good health, you cannot do anything. Even if you have money, you cannot spend it. So our health is of utmost importance to us, and it must be taken care of.